Hello, my name is Sabrina Griffith. Welcome. I'm going to talk to you today about computer physician order entry, or CPOE, medication errors, and how to reduce them. So sit back and relax and enjoy. A brief outline of what I'm going to talk to you about today. We're going to do the introduction to CPOE, how CPOE is utilized, the benefits of CPOE, medication errors, reducing medication errors in CPOE. What is CPOE exactly? Computer Physician Order Entry, or CPOE for short, is a set of medical instructions input by a physician for the treatment of patients. And I kind of chose CPOE because in my field of work, we use this like every day, and I see how it makes the process faster, to take better care of the patients. And if the doctors need an order really quickly, all they have to do is go into the computer system, the EHR, put the order entry in, and it goes to where it needs to go. And if there's something that I need to do, like I'm the person that actually carries out the orders. If the patient needs lab work done, I'm the one that actually put the lab work in the system once I receive the order from the doctor. So I think it's a great tool. So how is CPOE utilized? CPOE essentially eliminates the need for handwritten paper orders, and it achieves cost savings through increased efficiency. So if you take a look at this first picture that I have here, it is a handwritten physician order. And as you can tell, it may be a little hard to read or illegible, and it may be hard to transcribe. This next picture is a CPOE. The doctor put the order in the computer system, which makes it's visually better, it's legible, it just looks better from the actual handwriting. So, what are the benefits of CPOE? There's a warning prompt that tells you about the possibility of drug interactions, allergies, or overdose. In the picture that you're seeing, this patient is being prescribed acetaminophen COD number 4 tablet. Well, the warning that you see is that she's allergic to acetaminophen. So it's asking you, are you sure you want to add this allergy? So the warning message indicates interaction between the active medication and the allergy being added. So, the doctor does have the power to override that, but, it's kind of tricky. Another benefit is accurate, current information that helps physicians keep up with new drugs as they are introduced into the market. So a CPOE, it kind of pulls information from a database and keeps the system up to date so that the physicians can have the newer information about the medications. Another benefit would be drug-specific information that eliminates confusion among drug names that sound alike. So in that case, for instance, patient may be prescribed hydrocodone and they get it confused with oxycodone. So that's a confusion among the drug names because they do sound alike. Another benefit would be improved communication between physicians and pharmacists. We also have reduced healthcare costs due to improved efficiency. Medication errors. Over 1 million medication errors occur each year. Errors are due to drugs being administered to the wrong patients at the wrong time, drug overdoses, and drug allergies and interactions being overlooked. Although some medication errors are minor, they also contribute to thousands of deaths a year. Medication errors also have an effect on cost. It can make insurance premiums rise and losses in workers' productivity. So, with the medication errors and being administered to the wrong patients at the wrong times, a patient may need to take, let's say, aspirin 3 times a day every 6 hours. Well, if you have a patient thinking they need to take it 6 times a day every 3 hours, then that could be an overdose. So that wouldn't be good at all. So how do we reduce these medication errors? On the physician side, you have to avoid vague instructions. Specify the exact dosage strength that you want the patient to have. If a patient needs to take a low dose aspirin, which is about 81 milligrams, don't give vague instructions. They may think they have to take regular aspirin every day. Fully write out instructions about how to administer the drug. Do not use abbreviations for dosage units or for the name of the drug. When some patients are hesitant about asking questions, which they shouldn't, but a lot of patients don't know the abbreviations that people in the medical field know. A lot of patients don't know that PRN means as needed. So that's why you should not use abbreviations when using dosage units. Confirm that the correct patient is getting the correct dosage. Every patient should be given a wristband. You should check their wristband to make sure that their name, their date of birth, and their medical record number matches what you're looking at on the EHR and how to prescribe that medication. So make sure that every patient wristband, medical record number matches what you're giving them. Now on the patient side, the patient can help reduce medication errors also. If you don't understand something about the medication, ask questions. This is very important to ask questions. If you don't know what something is, ask questions. If you don't know why you're taking this medicine, ask questions. If you don't know what this medicine is supposed to do or the side effects of the medicine, you should ask questions. And also, you should keep an up-to-date list of all your current medications. This is important when you go to the doctor so that the doctor can know what medications you're currently taking so that he won't prescribe you a medication that will interact with the medication that you're currently taking. Make sure you have the correct medication when picking them up from the pharmacy. This is also important because you don't want to get home and you have someone else's medication and you accidentally take it. You never know what kind of interactions that can have with the drug that you may already be taking. Don't share medications. People have tendency to say, example, I have a headache. Do you have any Tylenol or aspirin that I could take? And you reach in your purse or you reach in your backpack or your bag and you hand them what you have. That's not good because you never know if they're taking other medication and it may have an interaction. So in conclusion, I think that CPOE is a great tool to utilize. I think everybody should use it. Learn how to use it correctly. Follow the warning prompts and make sure that each patient is getting the correct medicine at the right time. Thank you. Hope you enjoyed.